Today in Cannabis News, the Minnesota governor approves legislation to expand the state's medical cannabis system. The Texas Senate approves a proposal to broaden its state's medical cannabis system. And new research indicates that as more U.S. states legalize cannabis, calls the poison control centers for accidentally consuming too much cannabis among adults and children under 10 years is on the rise. It's Thursday, May 27th, and this is your TRICHOMES Morning Buzz.
Broadcasting live from the TRICHOMES.com studios in Southern California. It's time for your Morning Buzz. We bring you late-breaking news that keeps you up to date with what's happening in the cannabis industry.
First up, Minnesota Governor Tim Walz ratified legislation this week that sets rules to extend the state's medicinal cannabis system, including the ability for patients to use smokable cannabis items. By March 1st, 2022, or sooner, if rules are drafted and the state's cannabis commissioner approves it, the guidelines must be in place. Within the new legislation, dispensaries may also offer curbside pickup to patients. It also lifts constraints on approved caregivers, allowing them to now provide for up to 6 registered patients at a time. Social equity will be emphasized within the bill, in particular by maintaining diversified licensure and limiting corporate monopolization of the industry. Previous cannabis convictions will be immediately expunged as well. Drawing concern from advocates, one provision in the bill allows authorities to eliminate eligible conditions for medical cannabis if a request from a citizen or response team is received. At the moment, only the commissioner has the power of approving or amending eligible conditions.
Next up, the Texas State Senate this week issued official approval of a proposal that would broaden the state's medicinal cannabis system to encompass any instance of cancer and PTSD. However, it was significantly altered owing to a committee substitute. The proposal initially introduced would raise the THC threshold to 5% from 0.5%. However, a committee substitute from Senator Charles Schwartner reduced the threshold to 1%. In addition, individuals with untenable pain seeking alternative treatments to opioids were excluded for eligibility for the state's medical cannabis program by the substitute. After having received bipartisan backing in the state house, the bill seemed ill-fated as it entered the sessions last week with no planned proceeding. However, early this week, the Senate Committee on State Affairs heard the proposed bill from Representative Stephanie Click and with an 8-0 vote swiftly passed it. After receiving official Senate passage, now the proposal requires House acceptance of the Senate's modifications prior to being sent to the governor's office.
Last up, as per a study published in the medical research journal JAMA Network Open, a growing amount of individuals are contacting poison control services after inadvertently ingesting high levels of cannabis. According to statistics by the National Poison Data System, 28,630 individuals contacted poison control through January 2017 and December 2019. Individuals aged 21 and up were the most probable to contact, with produced cannabis goods such as edibles and vapes accounting for 38.5% of calls. The study also discovered that edibles and related cannabis-based items put children at a heightened likelihood of inadvertent poisoning. Of the total calls, 34.5% were from individuals aged 10 to 20 years, whereas children under the age of 10 years accounted for 27% of calls. The research discovered that calls concerning poisoning from ingesting cannabis-infused items like beverages, concentrates, edibles, extracts, and vapes were more likely to involve children of 10 years or younger than calls regarding items such as cannabis flower and joints. Dr. Brian Johnson, American Academy of Pediatrics Council on Injury, Violence, and Poison Prevention, Executive Committee member, noted it's a pattern that doctors and urgent care physicians have been seeing as more U.S. states legalize cannabis. The research discovered that cannabis items frequently contain higher levels of THC than unprocessed cannabis plant materials, which may lead to more immediate reactions like cognitive or psychomotor impairment.
And that was today's Buzz. Thanks for listening. For more cannabis news and insights from industry professionals and a place to discuss these stories and others, visit TRICHOMES.com.
And be sure to catch up with all of our other cannabis industry-related podcasts like Hash It Out, Careers in Cannabis, or the International Cannabis Conversation, wherever you get your podcasts. For TRICHOMES.com, I'm Devin Leal.
And I'm David Fortin. Catch you next time.